Therapeutic ultrasound is a therapeutic modality that is commonly used to treat soft tissue injuries within the body. These tissues include muscles, tendons, ligaments, and joints. So ultrasound is primarily used to stimulate the repair of soft tissue injuries and relieve pain. So the way an ultrasound works is all in the crystal. When electrical energy hits the crystal, it causes the crystal to expand and contract, creating a piezoelectric effect. So the expansion and the contraction of the crystal vibrates, causing the sound head to vibrate, and this results in a high-frequency sound wave that will enter the body and create a thermal or a non-thermal effect. The thermal effects of ultrasound include decreasing pain, increasing range of motion, decreasing inflammation, and increasing tissue extensibility or stretchiness. The non-thermal effects may include enhanced tissue regeneration, wound healing, increased protein synthesis, and an increase in calcium ions. There are many variables that go into therapeutic ultrasound, including the type of waves, the frequency of the waves, intensity, treatment length, treatment area size, application technique, crystal quality, and the effective radiating area. All of these can affect how well and how deep the ultrasound will penetrate the soft tissues within the body. So the first article I looked at discussed therapeutic ultrasound as monotherapy and how it can be used to treat chronic pain in joints, specifically the knee and the shoulder. So randomized controlled trials were conducted to evaluate the effectiveness of continuous and pulsed therapeutic ultrasound. So participants in this trial over the age of 18 with chronic pain were used. They used a validated pain scale to quantify the results. And in regard to the shoulder joint, the trial provided good evidence for pain relief with ultrasound as an intervention. Regarding the knee joint, ultrasound appears to be effective in treating knee osteoarthritis pain. Now, concerning the delivery methods, pulsed ultrasound had a less intense thermal effect in comparison with continuous. The results of this article concluded that therapeutic ultrasound is a widely used and effective method of treatment in musculoskeletal chronic pain. The second article explored the clinical effects of therapeutic ultrasound in knee osteoarthritis. So the patients used in this trial were 45 to 65 years of age and who had recently been diagnosed with osteoarthritis. A total of 67 people were included in this trial, and 34 patients received the ultrasound treatment and 33 received the placebo sham ultrasound. The scoring method used was a VAS that assessed movement and the WOMAC scale that measured the time required to walk 50 meters. Both groups showed reduced knee pain, and pain reduction averaged 20.6% in the placebo group and 42.8% in the treatment group. VAS measurements improved significantly for both groups, and the WOMAC scores improved in the treatment group much more significantly than the placebo group. Due to the considerable less pain in the treatment group on all parameters, this article finds that ultrasound therapy is an effective treatment in knee osteoarthritis. So the problems that I found with these articles, specifically the first one, it lacked numeric value rating the decrease of pain. It's counterproductive in proving their thesis because, evidence is really important in proving your point. And I just didn't find them to have a ton of numerical evidence, like percentages or anything like that. I found also that the criteria for selecting their patients was not as developed as it should have been. Now, the second study lacked a pure control group, which may have caused some limitations within their findings. The fact that both the treatment and the placebo group showed improvement may cast doubt on the effectiveness of ultrasound. Overall, though, long-term effectiveness needs to continue to be studied. Other application forms and patient variability needs to be explored in order to, specifically say that ultrasound helps and is 100% effective. And throughout this research, I learned how therapeutic ultrasound really works for reducing pain. Ultrasound is complex, multidimensional, and it was made much more clear to me through these articles. I learned that ultrasound compared to other forms of therapy is not as effective in treating musculoskeletal injuries, but used together generate even more improvements. And I also learned that the difference between pulsed and continuous ultrasound, and found that continuous ultrasound is better for treating pain.